Welcome to this session. This is Dr. Monika Sawhney. I'm an associate professor with the Department of Public Health Sciences at the College of Health and Human Services with the University of North Carolina at Charlotte. It is my pleasure to present today a brief overview of my research during summer 2020 about assessing the levels of breast cancer knowledge, risk factor awareness, and common barriers to screening methods among older women, a summary analysis. This was a research task that was completed by myself and one of my graduate assistants, Ms. Valeryia. I will be presenting this on behalf of both myself and Ms. Valeryia. Just to give you an outline of what this presentation contains, I will walk you through a brief introduction, the methods that we applied for the summary analysis, some of the prominent results we found at the global level in North America and in North Carolina, and some of the conclusions that we would suggest moving forward. As we all know, breast cancer is the most common cancer in most countries in the world, and it is ranked second among cancer diseases and fifth in terms of cancer mortality. Despite lot of awareness and lot of resources available, many women surprisingly still do not know about the prevention services like mammogram, and we try to understand what are the barriers, why people are less aware or why people are not ready to get their mammograms done. We also know that with an increase in levels of breast cancer awareness and knowledge, we can help with early detection, early cure, and reduce the mortality. So for this summary analysis, we collected information from databases including PubMed, Cochrane, Central, and CINAHL. We used some key terms like breast cancer, awareness, mammography, health behavior, etc. The inclusion criteria were women over 35 at risk or previously diagnosed with breast cancer across different race and ethnicities. A total of 55 articles were sorted by geographical criteria and summarized. The results were summarized at the global level, North America, and at North Carolina. Overall, the results show that countries show moderate to high levels of breast cancer knowledge. Awareness of breast cancer signs and symptoms also vary from adequate to severe levels. Mammography knowledge is minimal to non-existent. And also very surprisingly, that breast self-examination rates are also very low. Some of the common barriers to screening methods include fear of results, fear of the procedures, language. In many cases, it is lack of insurance as well as the cost factor. Let us explore the results at different level. I'll start on the rightmost corner with the results at global level. More than half of the countries that we found information about reported high levels of breast cancer and knowledge awareness at the global level. More than a third reported moderate to high knowledge of levels of risk factors, signs, and symptoms. Two-thirds of these countries document low to virtually non-existing rates of screening participation and knowledge of mammography. About a third of these countries report low to inadequate levels of breast self-examination. Let us see now what's being reported in North America. In US, low to moderate levels of breast cancer knowledge among Latina women. In Canada, among Asian and Iranian women. This could be because of the demography and the immigration pattern that these countries have recently seen. There is low level of awareness about alcohol consumption as a risk factor among American women. In the United States of America, relatively high levels of mammography screening participation. In Canada, however, there is low rate for clinical breast examination. In the US, we find it moderate to high. In North Carolina, there is a low level of breast cancer knowledge among immigrant farm workers. There is limited awareness of risk factors among immigrants. High levels of mammography screening among African American women, low levels of screening participation among the underserved women. So how do we move forward? We need to implement health education programs that encourage women to practice self-care. We need to incorporate local nurses and community leaders in delivering essential information about self-breast examination, clinical breast examination, and mammography. Introduce culturally appropriate health promotion programs. I want to take this opportunity to sincerely thank the Women and Girls Research Alliance for this funding and an opportunity for me to train a future health professional, Ms. Val, and for your time and attention for this presentation. I look forward to continued collaborations and working in this area to increase awareness about breast cancer and improving women's health. Thank you for your time and attention.